With a major selection of the looks your kiddos love starting at just $4 in the Walmart app, a new school year means a stylish new them. Who knew? Find skater skirts and Crocs that say, I'm casual but cool. Sparkly sneakers that say, it's my classroom, you're just learning in it. And preppy polos that say, I'm the teacher's pet, even if they're mommy's menace at home. Find their favorite styles starting at just $4 in the app. The Walmart you thought you knew is now new.
It's summer. Time to enjoy long days, lazy nights, and great food. Because Uber Eats has deals all summer long. So, when hunger strikes, don't sweat it. Delicious deals are just a tap away on Uber Eats. Enjoy all your favorite grocery items delivered straight to you. Get ice cream, soda, and snacks from your favorite stores like Wegmans and CVS and make the most of every moment. Now that sounds like a good summer. Order now on Uber Eats. Terms apply. Product availability varies by region. See app for details.
The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode.
All right, everyone, we're back with another guest this week. Would you be able to introduce yourself for us and give us some of your background in dentistry?
Absolutely. Hi, everyone. My name is Dr. Varisha Parikh. I'm a prosthodontist based out of Los Angeles, California. I did my dental school training at ASDO in Arizona. I did my pros residency at UCLA and graduated in the middle of a global pandemic in 2020. I started my own startup private practice in April of 2023, and I am currently in private practice as well as involved in lecturing, and I lecture on implant dentistry as well as digital dentistry.
Amazing. So there's lots to unpack through what you said. Let's just kind of start chronological. It makes the most sense. So
Sure.
when you were in dental school, what point did you decide that you wanted to become a prosthodontist?
Yeah, I, like most of us going into dental school, had no idea what a prosthodontist was. My third year of dental school at ASDO, they had like a pros clinic. So you would have your general practice and then you would take your pros cases up to the pros clinic. And one of the faculty members, who is now a super good friend of mine, was this young prosthodontist who had just graduated his program at UCSF. And I was just like floored by like how much knowledge he had. And really for me, I was interested in implant dentistry. So I was trying to figure out like, did I want to go surgical or, what other options there were. And in working alongside him, I was just like, how do you know all of this? And he was like, well, I'm a prosthodontist. And honestly, the next day I applied to residency. I also kind of knew myself where I'm the type of person who needs education that's in a very like structured academic institution. Like I didn't think that I would do really well with like going to CE courses and doing like a program like that. And I knew I wanted to practice specifically what I was learning. And so that's why I decided to go specialize.
Wonderful. So a lot of us, including myself, honestly, don't know much about pros residencies and the applications and things. Are there a lot of programs? Is it pretty competitive? How did that go?
It's gotten more and more competitive. I am amazed by the interest in prosthodontics. I feel like when I was thinking about it, every single turn or person I talked to was like, are you sure you want to do that? Like prosthodontists don't make any money. Like you should just go into private practice. And I felt like I was being constantly discouraged. And now it's great for me to see that people are actively choosing to pursue this as a career. There are quite few programs. I think the big challenges with pros residencies is a lot of those programs are not paid. So you would have to pay to continue your education. And that can be really challenging, especially with how expensive dental school already is. I was really selective in applying to only paid programs because I knew I didn't want to take out any more financial hardship to specialize. And residency is like, it's like literally jumping into the deep end, but like the pool is on fire somehow. is how I describe it. I went to residency at UCLA. The program is fantastic. There are great faculty, and they really have you seeing patients that are needing complex dental treatment from day one. So you have your like didactic and your lectures, but you're also seeing patients side by side with your faculty. And it's amazing because you're really like learning it at 7 a.m. and then applying it at 9. So that was really cool.
And how long are most of the programs?
So most all PROS programs are 3 years, and then you have the option of doing a maxillofacial fellowship, which is another year, or you can also do a surgical fellowship, which is another year. So all in, some PROS have been in school for an extra 4 years. For me, I did the 3 and then went out into private practice.
And you mentioned, I believe you said you graduated like 2020 and then you started your current practice 2023, if I'm remembering right. So in that interim, were you working as an associate somewhere?
Yeah, I think I consider it a privilege to say I've worked in like every single possible version of a dental practice you can have. So I graduated in the middle of COVID. It was June of 2020. I was really anxious that I wouldn't be able to find work. And at the time, I was also really anxious about not having benefits like health insurance, especially because there was so much uncertainty with, COVID. And so I decided to stay on at UCLA. So I joined on as faculty part-time. So I was there 2.5 days a week. And I was teaching the dental students and the PROS residents and really understanding what it meant to be an academic. I hadn't taken that off the table for me yet as like a full-time career, but it was kind of my introduction into it. At the same time, I was working as an associate in a PROS practice for another prosthodontist. And at the same time, so that was 1 day a week. And then another day, I was working as the prosthodontist in a perio practice. So getting the experience of doing like a group practice versus a solo PROS practice. And then after a while, the university kind of world, I realized just wasn't the best fit for me. I love teaching. I really enjoy it, but the red tape that's involved in academic institutions just wasn't my vibe. And so I left teaching at UCLA and I actually joined Clear Choice, which is a DSO. They focus on full arch implant restorations. And I worked there for almost a year, kind of during that time as I was working at Clear Choice is when I got the opportunity to start my own practice. And so I was doing those two things in parallel. And I started seeing patients in my practice April of 2023. But as anyone who's done a practice startup will know, that you are not at your own practice full time because you can't afford to be. You have 0 patients when you start. So I started at my practice 3 days a week and I was at Clear Choice 2 days a week. And then I officially came on full time at my practice October of 2023.
That's pretty good. I mean, that's relatively quick, April to October. Good job.
Thank you.
So between working at Clear Choice while doing your startup, was there any issues with like being too close together, patients like wanting to follow you? Was your other office worried about that? How did you navigate that situation?
That's a great question. I firmly believe that you can mitigate a lot of issues with just being super duper transparent. So I pretty much from the day I got the opportunity for my practice and knew that I was headed in that direction, was transparent with the owner doctor at the Clear Choice that I was working at. She is a great friend of mine. We know each other from residency. So having that personal connection was definitely helpful. And she was really excited for me. I think what was really cool is that I actually ended up getting referrals from them for my practice. And then I really realized that a lot of people have feelings about DSOs, but in the Clear Choice model in specific, it's a very specific DSO. They do literally one type of treatment. And so it was really cool that I was working there and I would see the other doctors be like, oh, you know what? Like you need this on the upper jaw, but on the lower jaw, you don't need this. You could go see Dr. Parikh at her private practice. And it became a really great like feeder in the beginning, which was awesome. So it ended up working out really well. But in those situations, for anyone navigating it, I always say like, just be super duper transparent.
And you said when you got the opportunity to do your startup. Tell me about that. How did you decide that it was time to do it, and how did it work doing the startup itself?
I was never one of those dentists or dental students that thought I wanted to own. Like, we know those people that you go to school with that are like, I'm going to own my parents' practice, or I'm going to come out and I'm going to buy 4 practices, and I'm going to, do all of the things that are related to ownership. I honestly didn't know what that would even involve. So I didn't have it as a goal. I wanted to practice my craft because I really enjoy what I do. What happened was I was in a situation where I was working or had been working for a while, and I was unhappy at some of the jobs that I had worked at. And it was getting to a point where that unhappiness was really making me question if I was good enough, if I was actually a good prosthodontist. And I had to do a lot of soul searching and like stepping back to realize that the environment that I was in was not setting me up for success. And so in turn, I felt so horribly about something that I knew I could do well, but the outcomes weren't as good as I wanted them to be. And that's when the idea of possibly owning my own practice came to fruition. And it just so happened that it was around the time that I was planning a wedding too. So I kind of, tabled the idea of owning to focus on planning our big fat Indian wedding. And literally at our wedding reception, one of my colleagues that was there, who's also a dentist, came up to me and was like, I have something for you. And it was literally at our wedding reception. His wife was like trying to pull him back, like, stop talking to her. And then the next day I got on the phone with him. He's like, hey, there's a suite available in this building. It would be a startup. I think it could be a good fit for you. Do you want to come check it out? See what you think. And 5 days later, I had signed a lease and I was in it. So it was kind of like kismet. Everything kind of fell into place. I don't want to say that I was like really going around and like searching for things. Like I hadn't been going to showings or working with a broker or anything, but I knew in my heart that like this was the right path for me and I was doing it for the right reasons. And yeah, that's how it worked out.
That's awesome. So you mentioned the styles, models of some of those other practices just didn't align with the way you thought you could best practice. So how did you structure your current practice to be something where you feel like you can thrive?
So one thing that I did not do well with was running around. Like I did not do well with juggling multiple columns. It's just not the type of clinician that I am. I could do it, and I think there's the important delineation between being able to do something and wanting to do something. And I worked in environments where I was numbing in room 1, prepping in room 2, doing a guard delivery in room 3, a hygiene check. I mean, I'm sure you've been in situations like that. I think we all can resonate with that. And I didn't like it. And so when I came into my practice, one thing I realized early on is I'm space constrained. So I say I have a micro practice. I have 2 operatories, literally 2 operatories. And so I knew that that wasn't going to be a situation where I'm going to be running around. But 2, I decided to be fee for service because I knew that if I adopted a model where it was high production, low volume, I could do what I wanted to do and practice the way I practice. So in my environment, you don't see me running between ops. Like my hygienist has her room, I've got my room, and I see 1 patient at a time, and I love it.
So that was kind of my other question. You mentioned you have a hygienist. So I'm sure practice models are different, but within prosthodontics, how does it typically work? Are people coming for a specific full mouth rehabilitation and then they're going back to whoever referred them? Do you have established patients? Like you said, you have hygienists. How does that work?
That's a great question. So it's the exact opposite of how it works in a GP practice. So in a general practice, you have patients who come in generally for hygiene, and then restorative treatment is diagnosed or educated to the patient, and you do the restorative treatment. The preliminary relationship that patient has with your practice is with the hygienist, and then obviously the clinician after the doctor after that. In my practice, people come to see us for restorative dentistry. And then from there, we guide them to where they can go for maintenance. So I actually didn't start this journey thinking that I would have a hygienist, to be honest with you. I thought exactly what you said was that people would refer them to me. I'd send them right back out. But what I found was I was getting referrals that were like, you got it, do it all, we're good, and it was because the docs that were referring these patients to me either didn't have the bandwidth to keep up with their maintenance, or they were worried that they didn't have the knowledge to, or the tools to service the type of work that we were doing for these patients. And so I began to think like, man, am I really going to let these people out into the ether after they've spent like however much money on their beautiful reconstruction? And that just didn't sit well with me. So we onboarded a hygiene program. It's 1 day a week. My hygienist has been with me since the beginning. She's a good friend of mine. And it's been really cool to see her build relationships to encourage patients to maintain the work that they invest in. And we do get a few friends and family or friends and family of patients that come in to see us for just like routine dental care. But that's a small percentage of what that looks like.
I'm always looking for ways to show my cat how much I love her. And with Fancy Feast Gems, I can pamper her whenever I want with a savory gravy on top of a gourmet mousse pâté. The pyramid shape makes serving simple, so all I have to do is peel and plate to make mealtime feel extra fancy. And with 2 entrees in every pack, it's easy to turn every day into the extraordinary. Fancy Feast Gems.
This episode is sponsored by Friskies, who would like to tell your cats hi. Now, if that didn't get your cat's attention, there is one thing that always does the trick. Just pour some Friskies crunchy food in the bowl and you'll hear those paws come running. Works every time. With so many Friskies choices, you can always bring your cats running from their secret napping spots. There's always more to explore. See for yourself at friskies.com or visit your local store.
And I mean, I have so many questions. I feel like I know nothing about what prosthodontists do. I'm sure most people listening are wondering this too. So you mentioned you love implants. Obviously, you can go as far as like full mouth reconstruction, implants, lots of crowns, things. But would you do like standard fillings only when it's part of a bigger plan? Like, what is the scope of procedures that you're doing?
Yeah, so it really depends on the origination of that patient. So if a patient was referred to me by a general dentist and they need traditional restorative care, like fillings, I simply ask the restorative dentist. I said, hey, do you want to do it or do you want me to do it? And I'll tell you 9 out of 10 times, they're kind of like, you got it. But there's some instances where they'll, like just the other day, had a patient referred to me with a stripped implant screw. She's got a bunch of other stuff going on, but the referral was very clear to say, hey, can you deal with this implant screw and send the patient back for the remainder of their treatment? And I'm happy to do that. So to me, at the end of the day, I call my practice a relationship practice. Like I figure out very quickly what I'm able to do for that patient based on their need for their relationship with me, their relationship with their other providers, and my relationship with the providers that are referring their patients to my office. And I very much am like a pick up the phone type of person. So again, if there's any question, I will literally get on a call or I'll go over to their office and say, hey, want to be super transparent. Like, where is your comfort zone here? How do you want me to help you?
Got it. And do you feel like as a fee-for-service office, it sounds like you're pretty steady flow of patients and everything. Do you feel like the next like 6 months that like you're for sure going to be busy, or is there that like question in your mind as a practice owner now, like hopefully like things keep coming? Like where are you at now that you've been owning for a few years?
It's hard. There's a lot of seasonality in what we do. I think that goes for an insurance-based practice and a fee-for-service practice. People don't think of seasonality when it comes to dentistry. They think of that when it's more like retail or restaurants maybe. But for us, there's seasonality. Like June's a rough month, right? It people are finishing school, they're going on vacations, and I think there's an assumption that if you're fee for service, you're insulated from that seasonality, but that's not the case, right? If my referrals are slow, then I'm slow. If my patients are traveling, or if a large number of them are traveling, they're not coming to see me. So I would love to tell you that I have it figured out, but the truth of the matter is I don't. What I will say is, now that I've been able to stick my head up from the sand of all the chaos that goes with building the practice and building the brand, now I'm really tracking. Like, I put numbers in a spreadsheet. I'm looking month over month, quarter over quarter. What does this mean for me and my business? And I hope that coming into the next group of years that I can just plan things better. And what I mean by that is like plan my life maybe around the seasonality of my practice, or if we, grow our team, better educate them on what that's going to look like.
Gotcha. And I'm curious, you mentioned, you have a lot of different network of dentists through your various schooling and just connections that you make. How did you initially start building the patient base beyond those referrals coming from Clear Choice?
I went door knocking, like no joke, cookies in hand, in boxes. I drove around. I introduced myself to every single office manager and doctor that would talk to me. I think the one other benefit, and this is for anyone who's thinking of, a residency or even like dental school, it helps to practice where you went to school. Because I already knew quite a few people. For instance, one of the oral surgeons that I work closely with, him and I were in residency at the same time at UCLA. So we've known each other since 2017. And those relationships are really helpful. And we practice in the same building, right? Like, those relationships are really helpful. I went door knocking. I went introducing myself. I attended a ton of networking events and study clubs. And I was doing the social media thing. And, it was just like throwing mud to a wall and seeing what would stick. And a lot of people ask me like, oh, looking back, would you not have spent this in marketing or not have spent that in marketing? And yeah, there are things I could tell you. Like, I did mailers to, send out to people's homes. And do I think that was the best use of our money? No. But at the same time, when you're in it, and you have taken out a loan and you have built this and you have the staff and you have bills to pay, you're going to do whatever it takes, right? And so I kind of had just adopted that mentality and just got my name out there.
And you mentioned like initially you didn't see yourself necessarily being a practice owner, or you weren't like dead set that had to be you. So once you decided you were going to do this startup, did you work with like a coach or a consultant, or have you just been making it all work from your own research?
I did a lot of research. I have not hired anyone formally to help me. I have done a lot of, podcasts, books, but the ultimate credit that, the knowledge that I have goes to is my husband. He has been in the startup world on the finance side for many, many years, even before we met. And when I wanted to, embark on this journey, he was just like there with me lock and step and like educating me on what I needed to know. I think it was like a shocker to him that we were never taught some of this stuff in dental school, especially when it came to like finances. And I am grateful to him for being patient with me and learning and allowing me to make mistakes, right? When you do a startup like this, like there's a reality you don't make income per se for a minute. And as a husband and wife, as a family, we had to have those discussions. But I was just really grateful to have him as a partner in teaching me. And I really wish that the info that he got from his years in finance and in business school, we would get a fraction of that in dental school. And so I've tried now to be able to go do like some guest lectures at UCLA to be really forthcoming about the finances and the business management side of owning and just in general being a dentist and navigating that.
That's wonderful that you're trying to give back for what you felt was lacking with the education of it.
Totally.
So you mentioned this earlier, and I mean, we're already talking about finances, and I even watched one of your TikToks yesterday about like people saying prosthodontics is a dying specialty, like you were saying that earlier. Do you feel like it's been financially worthwhile? Has everything been working out, generally speaking, for you?
I think it's like a loaded question. And I like TLDR, I think yes, it has worked out for me, but I don't always feel that way. You can probably ask me like tomorrow and I might give you a different answer. I think to me, and this is always like this is why it's such a hard topic to talk about because the answers can sometimes come out as like cliched or like being downplayed. Like for me, I'm really happy, like mentally, emotionally in my practice. And that happiness drives a lot of value because before saying that I'm an owner or I'm any of the other things, I personally believe that being a prosthodontist is like my calling in life. And like, I take that very seriously. So that happiness has been incredibly worthwhile. And it hasn't always been that way. Like I was saying, when I worked at other offices, I like literally had an identity crisis because I was like, am I a bad prosthodontist? Right. And that's hard. That's a hard thing to navigate and still show up for work the next day. Because we're talking about real people, real skills, real treatment. I think financially, 100%, it can be worth your while, but that's something different for everyone. For me, I have, like I said, a micro practice. My overhead is completely minimally well managed. I have a team of 4 people. I have a 2-op practice. We have a lot of technology that we've invested in with printing and scanning such that we can do a lot of the lab stuff in-house, which helps mitigate costs as well. And that is what works for me. But I know friends and colleagues who own 2, 3, 4 practices, and that's what they wanted to do. And I think if you ask them about finances, their answer will be just as convoluted because there's so many different aspects to their finances. So I think a lot of it comes down to really sitting with yourself and asking, like, what do I want? Like, what am I looking for? And also putting numbers to that. Like, there's no shame in being like, I have this numerical goal and I need this to be comfortable in living my life. How am I going to get to that? I live in an incredibly high cost of living area too, right? Like LA is expensive. There are things that we have as goals as a couple and as a family. And so again, my thing always comes back to transparency, like being transparent with yourself and the people that are helping you. And you can make it work. There is a path, especially as a prosthodontist for anyone out there who's interested.
I love that. And I talk about that a lot on my podcast too. It's like creating your life around a way that will make you feel fulfilled and, working backwards, like you said, like this is what I want, dollars wise, how I feel, and work backwards to engineer a life that's going to get you there. So it seems like you've done
especially with the nature of what it means to make money in our profession, right? I've talked about this on TikTok. You as a dentist do not make money unless you are doing dentistry. Doing dentistry involves you being in an operatory with a patient doing some type of work, right? And that simple fact alone changes a lot of the calculus, because if you are wanting to make a certain amount, but you only want to work 2 or 3 days a week, you're not making income on the 2 days that you're not working, right? So it really, the nature of our field is so interesting that way because we don't get the benefits that most of our corporate colleagues do in other industries. We don't get PTO, we don't get accrued time off, we don't get banks of things that we can still be making passive income while not being practicing, especially as like an associate. And so I think like once that we accept that reality and we understand it, then like you said, you can kind of work backwards and plan what that means for you.
And you mentioned, and talking about creating kind of the best life that suits you, you mentioned you're married. I'd love to know a little bit about how you manage being a business owner, dentist, along with your personal life.
I don't think I do. I'm just going to be very honest. I actually listened to a podcast recently with Emma Grand, who's she's a founder of like Good American and Skims, and she has a podcast of her own, and she says like work-life balance is not really a thing, and I firmly believe that. I love, being able to be present in all aspects of my life, but what I am starting to learn is that in order to do so, you have to draw these really hard boundaries sometimes. And that's also something that's not intuitive to us. We are fixers, we are healers. That's why we went into this profession, right? And in doing so, we take our work and our thought and our mentality with us everywhere because we're thinking, we're trying to fix, we're trying to troubleshoot. And sometimes you try to do that to your personal life, try to do that to people in your personal life, and it doesn't work like that. And so I think balance items that have worked well for me have been, really like I am done at 5. Like my team knows this. I'm a morning person, so I get to my office early. I get all my work done before people come in. I see patients, and I am out the door at 5. And that was not always the case. I was usually clocking like 12-hour days when I first started. But I leave by 5 and I don't touch or talk about anything related to my practice till after dinner. And even if that, I try to avoid it, but that time after I leave here, I dedicate it to exercising, going for walks, talking to friends and family, being at home, cooking and doing our house stuff. And then if I need to do things afterwards, I will, but I try really, really hard not to. And I can't say I'm perfect every day, but I think that has been like, and that sounds so basic. It's literally like a schedule, but in practice, it's a lot harder for a lot of people to implement, myself included. But that kind of on this micron level, kind of doing that has helped me out a lot.
Did you initially, when you were setting your hours and days for your practice, try like being open to accommodate the client, or were you like, no, I'm doing this my way, I only want to be open 3 days for these hours? How did you structure that?
So I was pretty hard and fast about the days and hours. We're open 4 days a week generally. Monday, Tuesday, Wednesday, I'm 8:30 to 5, and then Friday I'm 8 to 2. And that has pretty much been our schedule since when I opened, and I was pretty, hard and fast about that. I think what I wasn't so good about is I was more open to taking a lot of the work home. So what I mean is I would sign myself up to do a ton of lab work. I didn't educate my team on how to help me on the lab side. So all of that fell on me. Notes was another thing, reports, emails, like all of that stuff. Even though I had this extra day in the week, like my admin day, I still felt like I was behind sometimes. And so that's where I really had to work on being like, how can I be so efficient during my day that when I'm done, like I'm done and I can truly have like time away from my practice. And it also comes with the maturity of the practice, right? Like now I have people who know me, they know how I operate. I know how I operate, so I can communicate that better. I think each passing year, it will get easier. Or so I keep telling myself.
I love that. I've really enjoyed hearing your story and hearing about how your practice has grown over the years. Before we wrap up, I would love to know if you can share where your TikTok is, what your TikTok is, so people can check it out because I definitely love following you there.
Oh, thank you. My TikTok is Pros Queen, because what else would it be? And my Instagram is Dr. Varisha Parikh, and I would love to, connect with y'all on socials and whatever more, you or your followers or whoever wants to know, like drop a comment, or DM me because I like to think I'm an open book and I'm here to share. There's a seat at the table for everyone.
Beautiful. Thank you so much for your time. I really appreciate it.
Thank you so much for having me.